maybe what I'm referring to more is providing Suboxone, providing methadone, especially in the setting of where like you could see their UDS over the past month and you're like, dude, you're still using cocaine every week and
Right.
like meth, like what's going on here?
Right. So I think there has to be a recognition and an admission that many patients are not ready to give up whatever substance that they're using. So the question becomes, as the critics ask and pose all the time, is this just a way of enabling somebody's drug use?
Right.
Because look, you look at every single interview that's done on Skid Row, right? What's the most common thing that you hear? You're like, they talk about the fact that everybody's here and they don't want to get off the substances. They're here because they want to use drugs. It's readily available and they're able to get free needles. They are able to get free food and all their basic needs are met for them because of the community support that's provided in the name of harm reduction strategy, right? So essentially, for many people, it is a fact that this environment does become just a way of continuing their drug use, but in a more comfortable manner where they don't have to worry about things like food or emergency services because there's so much support around them. So that really got me thinking. And if you kind of extrapolate that out to like the most extreme versions, so for example, I don't know if you noticed, if you realized, but I didn't. I only recently found this out. Right now in New York City, there's what we call a supervised injection site.
Right. And I know like Ontario, Canada, Vancouver have very similar things.
Right. So the one in New York is relatively new and it's not without controversy. But interestingly enough, there was recently one in San Francisco in the Tenderloin district. It actually opened in January of 2022 and closed down in December 2022.
Interesting. Tell me more.
So the idea behind that program was that they're gonna, people are using drugs, right? Harm reduction strategy. So we're gonna create a safe environment so that we can intervene for overdoses. And a major component of that program was supposed to be diverting patients that came into mental health services. So giving them the help that they wanted. But interestingly enough, less than 1% of people that came through those doors got hooked up with mental health services.
Interesting.
Which to me, it clearly screams they're not interested in treatment. So that brings me back to the question, are these strategies simply encouraging and enabling drug use? And if we're asking those kind of questions, like what do we say about, like you said, like should we be providing heroin to people, right? People commit crimes, they commit robberies because they want to avoid withdrawal, which arguably puts them into really dangerous situations. So if the whole idea, philosophy behind harm reduction strategies is to keep that individual from having adverse consequences secondary as a complication to their substance dependence, why not, why draw the line at needle exchange programs? Why not just provide them housing? Because if they're using drugs that they're out in the elements, they're susceptible to getting, pneumonia, colds, whatever it may be. Why not provide them with heroin or any other substances that they're using? Because you can make an argument that they're putting themselves in harm's way to obtain these substances, right? So I think that's where the philosophy behind harm reduction strategies get a little bit murky. I think there's a line that's drawn. So for example, right, needle exchange programs and providing somebody with heroin, right, they're on different ends of the spectrum, arguably, right? So while some people may be comfortable with needle exchange programs, that person might not necessarily be comfortable with supplying individuals with substances. So I think for many of us, there is a line somewhere. And the question is, where does that line lie for you? I think for everybody it's different. And I don't think this is a conversation or a thought that many individuals have had on a very in-depth level. I mean, I certainly haven't before I started doing research for this podcast. I didn't even know they had supervised injection sites.
Oh, really?
Yeah, I didn't know. I didn't know about the thing in San Francisco.
Part of me almost like, it's like, that scenario you described, and I know that's how you don't truly feel. That's why I asked, like, do you agree with that? But like, should we be providing these people housing and just, I don't agree with that. Here's your baggie for the day. Yeah. Like that's completely one side of the spectrum. Right. And I feel like the other side of the spectrum is like, in a sense, like pure Darwinism. Like if a person is susceptible to HIV and endocarditis, like were they forced to inject that stuff in their arm? Sadly, actually, maybe the answer is sometimes yes. Like, I mean, there is a world of abuse and human trafficking that we live in, of course. But a lot of times there's, I don't have the numbers, but they choose to do that. And is like, are you going to take a purely Darwinian approach and just like, let them, the finest will survive and the weak won't? I certainly don't agree with that, but I don't agree with the complete opposite end of the spectrum too either. Like providing them housing, giving them a bag of heroin every day. It's like, so I agree with you. It's like, where do we find that line in the middle? And I think that's what's most important here, right? And maybe and why we kind of started this discussion. I actually have a few more questions that I want to ask you, but like these are the kind of questions that I want to be asking and talking about when me and you serve, hopefully on advocacy committees. Maybe even try to influence politicians in some regard to make smart decisions. I don't think that we need to be arguing necessarily about that chart, about what we're calling all these things, right? Alcohol use disorder versus all these things. So I won't say
it seems silly compared to some of the other real issues impacting everyday people.
So here's a very profound, I think, kind of philosophical question. I'd be very interested to get your thoughts. So I have an attending who you work with as well, who has practiced in another state, I believe it's Kentucky, and we're in New Jersey, remember listeners, that in the state of Kentucky, there are certain legal provisions where psychiatrists, we're psych residents, remember, soon to be psychiatrists, can legally force somebody into substance abuse treatment. Here in New Jersey, to my knowledge, and I could be wrong, at least in a psychiatric sense, me and you can never force somebody into substance use treatment. I think that there's other provisions if you hit like X amount of DUIs that the legal system can force you into substance use treatment. But me, in a medical sense, I cannot. In other states, though, that is different, where a medical person can force them into treatment. What do you think about forcing a patient who lives with, let's call it opioid use disorder, and forcing them into an inpatient rehab?
Perhaps it's not a popular answer, but I always tend to err on the side of patient autonomy. I believe that, we live in a free country, right? If you want to abuse alcohol to the point that your liver rots away, you get liver cirrhosis and you end up passing away. As long as you understand that that is what's going to happen if you continue to drink incredible amounts of vodka every single day, I think you do have the right to pursue that kind of lifestyle, as long as you're not harming anybody else, right?
But what if that person committed a crime with their heroin use?
Well, then,
or fentanyl use, even.
I see what you're saying.
Crashed a car.
Because then they're going to be locked away, and as we know, a lot of people in our criminal justice system are suffering from mental health issues, and arguably that is, the prison system is not the right setting for them, and they would more benefit from psychiatric treatment. So I see the moral dilemma that you're getting at, and that's what makes this conversation so complicated. And I think, overall, this ties into the issue of harm reduction strategies, right? Because at the end of the day, like, I think we just need to take a step back and recognize that things like needle exchange programs, they've been around for a while. So if these programs truly do help society, why is it that we're seeing record amounts of opioid use disorders, record amounts of deaths from opioid overdoses? So when you strictly look at, and I know it's a more complicated issue than that, there's obviously multiple co-founding factors that's gonna influence the final data that we get. But if you just look at what's happening in our major cities, the amount of needles that are being found on the streets, like it's skyrocketing, and we know the number of people abusing opioids are increasing every single year. I don't know if you saw there, like a month ago, there was a very viral post on Reddit about a sanitation worker, I believe, in the city of Portland, where he's showing the amount of needles that he collected from the streets and disposal centers. Wow. Have you seen that video?
I have not.
Okay, I'm going to show it to you real quick. This is a 20-second clip. It shouldn't take too long. All right, so give me 1 second.
So while you're pulling that up, I want to share some of my thoughts. So I actually worked at an addiction center prior to medical school in Connecticut, Mountainside. Great experience there. If you need addiction services and you're in the Connecticut area, I would check out Mountainside. I'm proud to say that I was previously an employee there, and I think highly of this place. That being said, I nothing against the institution, the company, but there was individuals there who were forced to be there by law. I don't know the exact details of why they were forced to be there, but they were forced to engage with a month-long substance use treatment. I don't have numbers in front of me. Remember, this is anecdotal. And this is also my opinion. But I would feel that a lot of times those individuals were kind of just going through the motions. You could tell they didn't want to be there. They were forced to be there. Look, maybe sometimes that yields a good outcome, but I don't know. You could kind of read between the lines and get this sense that as soon as they walked out that door, they were going to go right back to their alcohol or whatever it was.
It's that old saying, you can't be trying, as a physician, you can't try harder than the patient. There has to be some sort of self-motivation, internally derived desire to achieve that outcome of sobriety, if that's the goal.
Well, and I actually really push, and I agree with you that I feel like of all the principles of medicine, autonomy is, like, in my opinion, one of the most powerful, important things. Because in a sense, if someone else is forcing you to do something, immediately gut reaction is like, well, I don't like this feeling. I'm being forced. I feel like someone else is controlling me. Like, I don't want to do that thing that someone else is forcing me to. Like, that's my, at least, opinion. And so I really get frustrated with, like, forced substance use treatment. And I get that sometimes it can yield a good outcome. I acknowledge that. And maybe it is appropriate in some settings. I don't like to take this all or nothing approach, but I have seen it not work for sure.
Right. And I will acknowledge there are logical inconsistencies in my stance, because certainly if a patient comes into the ED saying that they're suicidal, they try to slit their wrist, right? We're committing that patient. We're going to send them to the inpatient facility. And arguably with opioids, alcohol, whatever it may be, if you're abusing it to the extent where it becomes a real problem, we know with continued use, eventually you're going to die. It's going to kill you. Mm-hmm. So although it may not be an immediate death, as in when we typically think of suicides, it is leading to the same outcome. Right. So in that sense, yeah, there is a logical inconsistency on my part. But at the same time, that's what makes psychiatry, many aspects of psychiatry, so tricky, right? Because you're always trying to balance your role as a provider, your role to keep the patient's well-being first and foremost, with trying to balance that with respect for patient autonomy and not taking away somebody's civil liberties. So Logan, here's that video. Check this out.
Good morning, everybody. I just wanted to give everybody a little example in Portland, Oregon. How much used rigs we clean up off the streets.
Whoa, I'm looking at, multiple garbage cans just full of needles. Holy crap, that's probably,
each one of these
15,
is probably
20?
100 pounds. Used rigs only.
Dude, he's sticking his hand in there. I wouldn't do that. Ugh.
Used rigs.
It's been processed.
Thank God. Yeah. I'm like, dude, I could give you some medical advice right now, man. Wear some gloves. Oh, man, and there's a whole nother bag? Oh, my.
What the fuck?
Like, I really, when I'm looking at this video, I feel like a visceral reaction, like literally kind of sick to my stomach.
It's jarring, right? You know, one way to think about it, of course, we have these discussions in an academic, intellectual sense, but when you see a video like this, what's actually happening on the streets of our major cities, it's unsettling at the very least. So I think, it's a complicated topic. It's a uniquely human issue. And like with many other uniquely human issues, there's pros and cons. And I don't think this is, certainly this is one of those issues where there is not a 100% complete consensus on what the correct approach should be. And I'm going to be honest, I have no idea. I honestly don't know if I'm ready to say, like, I don't support needle exchange programs, because they do. There are benefits of it, right? It does reduce rates of HIV, other transmissible diseases, hepatitis. We can go on and on and on. So there are certain benefits, but we also have to acknowledge the other side of it, that that the use of opioids in our country is continuing to skyrocket, although that's not strictly tied to the failures of harm reduction strategies. It's a much more complicated issue, but perhaps it is a part of it. And that's the reason why we're having this conversation, right? To try to parse out some of the nuances.